Okay, now moving on to chapter 2, action at an emergency. I'm going to also put some video links at the bottom for you to be able to watch. These are links from the American Red Cross's website that can give you some other information when it comes to taking action at an emergency and going through those steps and letting you actually see those steps being processed. So for this chapter, we are going to identify barriers that might prevent a bystander from responding to an emergency, identify the steps for responding to an emergency, identify how and why to seek medical care, and then explain the steps for calling EMS, identify the steps for sizing up a scene, and identifying steps for preventing disease transmission, and explain how to put on, take off, and properly dispose of contaminated gloves, which is something that you're going to need for video presentation number 1. All right, so when we think about emergencies, there's some reasons why people won't respond to an emergency, okay? So those things can vary from lack of knowledge, confusion about what it is an emergency, and then characteristics of the emergency. So lack of knowledge is typically those people who don't feel they're competent to deal with an emergency, or they think that it might be something that's too above them, that they're not first aid certified, or they're basic first aid certified, and the scene looks a little bit scarier than what they're able to take care of. Or they just don't feel comfortable with the situation, meaning that it might be some kind of act of violence or something like that nature. In those kinds of situations, the best thing to do is to call 911 and get somebody there that can help besides you, okay? And then also confusion about what is an emergency. So when does it exist, okay? So let's say a motor vehicle accident. You know, a lot of times we're driving on the interstate and we see a car and there might be sitting in the median. They don't look like they've had an accident. It just looks like they're pulled off. You don't know. That person could be having a heart attack in that car. They could have passed out. They could have had a seizure. There's a reason why that car is sitting in the median. So do you make the decision to stop and provide care, or just to pick up the phone and call 911 and say, hey, there's a car sitting in the median. It's not moving. Can you send somebody to check that out? And they can do that. That's not a big deal. They can send a cop to check on it, okay? And then characteristics of the emergency. Is it unpleasant? Is there blood? Is there vomit? Are those kinds of things there that are going to make you not want to help with the situation? And then also, when you arrive to the situation, you know, you might see an accident and you might see 2 or 3 people standing around and just assume that those people have called 911. Don't ever just assume that someone has already called 911. Go ahead and call. I was actually at a situation where we were at a function for my child's school. Their school is right on the service road here in Ruston, and a car pulled out of the parking lot onto the service road, and they got hit, and they were hit pretty badly. The car was hit, and there were probably a good 150 people standing around. And I immediately pulled out my phone before I ran out to check on them and started calling 911 because I knew that somebody would need to come and respond. Of those 150 people, do you want to guess how many people called 911? One, me. I was the only one. So don't assume that everyone's going to call 911. Just be that person. Just take it. They can get the phone calls. It's fine. Okay? All right. So in an emergency, there's some things that has to happen. The bystander, if that would be you, is a vital link between EMS, emergency medical services, and the victim. Typically, it is the bystander who recognizes the situation as an emergency and acts to help the victim. Okay? Bystanders there's not EMS driving around looking for accidents. They're waiting for you to call. Okay? Bystanders must make a series of decisions and actions to decide whether they're going to help. Okay, so the first thing that a person must do is recognize the emergency. Okay, the second thing they must do is decide to help. Then they must decide whether they need to call 911 if it's needed. Then they need to check the victim, and then they'd give first aid. Okay, and we're going to go through each one of those steps in greater detail within this chapter. All right, so the first thing is recognizing the emergency. To help in an emergency, the bystander must first notice that something is wrong. Okay, what's the severity of it? How bad is it? How far is it away? How far are you from the victim? Okay, meaning are you in your car and they're on one side of the median and you're on the other, meaning that you're walking across campus and you see someone across the street from you pass out. What's your physical distance from the victim? What's your relationship to that victim? Are they a stranger? Are they your child? Are they your mother, your father, your grandparent, your sibling, a friend, your roommate? And how long, time exposed, how long have you been aware of the situation? Could it be that maybe your roommate gets sick and at first they're not feeling well, but then all of a sudden within about 20 minutes you realize that it's really bad and that they do need care? How long have you been aware of the situation? Those are all questions that EMS is going to ask when you call them. Okay, so recognizing the emergency is the first step. The second is deciding that you're going to help. Okay, so let's think back to that roommate. Okay, so let's say your roommate gets sick and they've been throwing up for a little while, and you go in and you check on them and say, hey, how you feeling? And they're like, oh, I don't feel good. But then all of a sudden, 30 minutes pass and you don't hear from them anymore, and you walk in and maybe your roommate's passed out. Okay, so at that point, you have to make the decision to help. Okay, at some time, everyone will have to decide whether they're going to help someone or not. If you become a parent, you're going to be helping a lot. Okay, some people might decide to refuse consciously or unconsciously to acknowledge that emergency. That day that we were there and I was the only person to call 911, I made that decision, and other people sat and saw the accident. They could not have seen the accident. But for some reason, they unconsciously or consciously decided just not to pick up the phone and call. Okay, so for that, to decide to help, there's some things that we can do to develop a helping attitude. We can appreciate the importance of being a bystander and know what your role is. Feel confident enough that helping someone who's seriously injured or ill, even if someone else is present, be willing to take the time to help, be able to put the potential risks of help into perspective. Stopping on the interstate to help with an accident, that's kind of a scary thing. So are you willing to take those risks? Feel comfortable about taking care at an emergency scene, and then feel comfortable about seeing or touching a victim who's bleeding or vomiting, or who actually might appear to be dead. Are you capable of doing those things? Okay. All right. And then 3, calling 911 if it's needed. Okay. So seeking medical care. To be able to decide when to call 911 for help, you must be able to tell the difference between a minor injury or illness and a life-threatening one. Okay. So if you answer any of these questions, then you need to call 911. Okay. So is the condition life-threatening? Could the condition get worse? Does the victim need more advanced help or skill? And could the distance or traffic cause a delay in getting the victim to help? Or is a spinal injury suspected? If you answer any of those questions, it's usually best to call 911. And sometimes it's easier just to err on the side of caution if you just don't know. If someone has a minor injury like a broken arm or, a mild cut that might need stitches, they probably don't need transport from EMS. But if you don't know, just call. It's better just to call. Okay. Here's some more detailed lists of things that are the reasons why you might call 911. You can pause and read through those if you want to. You might need to know some of these for your quiz, so I might recommend that you might pause and read through those. Okay. So when we think about that, we have to think about the steps of how to actually call EMS. Most communities nowadays have a 911 system, but not all. So if you live in a really rural community and you don't know whether you have 911, it's probably best to look up and make sure that you have those emergency numbers either programmed into your phone or in your car or in your house so that you know to call them. Like I said, typically most people it's 911, but you just never know. You might be in a really rural area where they just don't have 911 yet. So when calling 911, speak slowly and clearly, and then be ready to give the person your location, the phone number you're calling, just in case you become disconnected, and your name. Tell them what happened, tell them the number of people who are injured and any special conditions, and then give them the victim's conditions, okay? If you don't know those things yet, let them know that, okay? So let's say you're at a car accident and you're running up and you see the car accident and you know that there's people who are injured and you just aren't to them yet. Let them know where they are, okay? Let them know how many people you think might be involved, because that might mean that they need to send more than one ambulance, okay? Don't hang up on the phone until the dispatcher tells you that it's okay to hang up, okay? Nowadays, they can typically call you back and they can track your numbers, but it's just important to do that because not all systems have those capabilities yet. All right, so now we've decided that we either did need to call 911 or we don't need to call 911. So we need to check the victim. And one of the very first things in checking a victim is sizing up the scene. Okay, so before approaching the scene, do about a 10-second scene size up and look for these things. Hazards that could be dangerous to you. Are there power lines down? Is there gas leaking? Are there chemicals? Is there fire? Is there electricity? Those kinds of things. Cause of the injury or illness, and the number of victims. Okay, all of these things are going to kind of help you decide how you're going to assess and how you're going to treat that victim. we're going to talk about that a little bit more in chapter 4 on an actual scene size up, and you're going to actually get the chance to see an image and size up a scene. Okay, so there's some things about that we have to do, some steps that we have to take. Now we've decided to help. We're going to check the victim. There's some things that we have to do to protect ourselves. The CDC, the Centers for Disease Control, recommends that you take standard precautions to prevent disease transmission. They also advise you that you assume all victims are infected and can spread diseases. Okay, hand washing, personal protective equipment, face shields and gloves, and proper cleanup after an emergency are all things that you can do to help prevent disease transmission. Okay, some diseases of special concern: infectious diseases. Infectious diseases are a medical condition caused by the growth and spread of small, harmful organisms within the body. Airborne diseases such as tuberculosis, severe acute respiratory syndrome, SARS, and the flu are all infectious diseases. And then communicable diseases is a disease that can be spread from one person to another. So bloodborne diseases, HIV, hepatitis B, hepatitis C, those are all bloodborne injuries. So there's a difference between those, and you need to know those. Okay. Hand washing is the simplest and most effective way to control disease transmission. Even if you are wearing gloves, you should wash your hands before, if possible, and after contact. Okay. Proper procedures for washing your hands is use soap and warm water if possible. Rub your hands together for 15 to 20 seconds and wash all surfaces, including your wrists, your palms, the back of your hands, your fingers. Rinse the soap from your hands and then dry your hands completely with a clean towel. Hand sanitizer is acceptable if soap and water are not available, but they shouldn't be your primary form of cleaning your hands. Okay. Some personal protective equipment that you can use: exam gloves, mouth-to-mouth barriers, eye protection, and gowns. Those are things that you can use or consider protective equipment. Here's a mouth. This is a mouth-to-mouth barrier. There's even mouth-to-stoma barriers, those kinds of things. Goggles, covers for your mouth, and then gowns. These are all different personal protective equipment you can use. Okay. All right. So exam gloves is the most common type of protective equipment. Latex or vinyl, it completely depends on your preference. Some people are allergic to latex and need to use vinyl, so it's usually better just to go ahead and get the vinyl. Latex are typically cheaper, but they're also, the other thing about latex is they're actually better because it has fewer micropores, meaning they're very small holes that are within the design of the plastic, and so therefore more protective. Okay, but there are people who are allergic to latex, so it's your pick your choice, whichever one you want to purchase and be able to use and have in your first aid kit. You will need to purchase some exam gloves. You don't need a bunch, just enough to be able to do your video assignments and to have within your first aid kit. Okay. All right, so you're going to put on and remove gloves. So for putting on gloves, taking them off, partially remove the first glove by pinching at the wrist. Remove the second glove by pinching the exterior with the partially gloved hand. Okay, so you see how they pull it. He pulls one halfway down and then pulls the other one halfway down, only touching the dirty surface with the dirty surface. Then you pull the second glove inside out towards the fingertips. Okay, grasp both gloves with your free hand, touching only the clean interior surface. So you notice he's using his clean hand to touch only the interior surface, the clean side of the gloves. Okay, you're going to properly dispose these gloves. The best thing to do is to put them in a biohazard bag. If you don't have biohazard bags, put them in a plastic bag and dispose of them properly, meaning in the trash can or somewhere like that. Let's just say the reason why we want to put them into some kind of container. Let's say that blood is on those gloves and you're at work or you're at home or whatever, and you throw those bloody gloves into the trash can. And it's pretty normal, don't lie, I know everyone has done it. Let's say you drop something by accident into the trash can and you reach over and you start digging through. And let's say you threw those bloody gloves in at work and someone drops a pencil or a pen or something into the trash can and they need to get it. And let's say that those soiled gloves are in the trash can and they're not contained within a bag. Okay, so now that person is going to touch that blood, and that's going to completely negate the purpose of the protective barrier. Okay, so we want to put those gloves into a plastic bag and dispose of those properly. Biohazard bags mark those as being contaminated, but not everyone has biohazard bags, and I understand that. Okay, all right, So cleaning up after emergencies, let's say you have a lot of blood or you have body fluids that has spilled, vomit, those kinds of things. If you ever worked at a swimming pool, you have cleaned up lots of bodily fluids of various types. So when cleaning up blood or other blood body fluids, protect yourself and others against disease transmission. Again, wearing heavier gloves than latex or vinyl, so like kitchen gloves, those kinds of things. Use absorbent barriers to soak up blood or other infectious materials if you are trained to do so. Clean the spill area using soap and water, and then disinfect with bleach and water solution. Okay, that's a 1 to 10, so 1 part bleach to 10 parts water. Discard contaminated materials in appropriate disposable containers, and properly clean yourself if you have been exposed to blood, meaning wash your hands or take a shower, whichever. All right, so that will be the end of chapter 2. If you have any questions, please feel free to send me an email, give me a call, any of those things, and I'll get back to you. Make sure that you email me correctly with your name, reason why you're emailing me, so that I can make sure I'm getting right in touch with the right person. Make sure that you take your weekly quiz and finish up any other video lectures that you need for the week. I will talk to you soon. Have a great day.